They just are foam squares, but we'll pretend to apply the pads, right? Then we greet our patient. Hi, my name's Christine. I'm your athletic trainer. I've been instructed to tape your right ankle. You're Alyssa, right?
Yes.
Very good. So we've confirmed her identity. Now we'll set up our patient, scoot back a tad. Keep going, keep going, keep going, and straighten out your leg. Just bend this one aside so people can see it. Yeah, very good. Or straighten out your leg for me so I don't break my back. And pull here to the calf. Very good. Then we're going to apply our tape adherent. I spray the tape adherent where the heel lace pads would go. Lanyards, I'll just tell you, you could remove them. They always get in my way when I'm taping. Okay, so you'll remember, what is the patient position? How should their foot be? Dorsiflex, 90 degrees. That's a 90. Keep it there the whole time. Now I'm going to go slow today so you can see, but generally the slower you go, the more foot there gets tired. Your heel lace pads would go before your pre-wrap. Goes on the heel, goes on the laces. That's what I need you to do to get that point. And if you want to make my job easy when I'm practically grading you, verbalize the steps as you're doing them. I'm applying my heel and lace pad. Now I'm applying my pre-wrap. When you actually have a heel lace pad, you need to first use your pre-wrap to hold those in place. So I'll just pretend they're there, that strip. Then you want to go to the 5th metatarsal, because that's what you're going to be covering. I actually do 2 heel locks with my pre-wrap to cover the heel. You don't actually have to cover the heel because the back of the heel, circular part, shouldn't be exposed with tape. If it is exposed with tape, you did a step wrong. Okay, now that we've got our heel, or our pre-wrap on our ankle, keep it 90 degrees. Now we're going to do our first strip. The first anchor strip goes at the base of the calf. You see where her calf muscle turns into tendon? It kind of curves and then goes straight, right? So that first strip is going to go there. Then the second anchor, keep it 90 degrees. You don't want to put pressure on that 5th, so you apply it just proximal to the base of the 5th. Then the next step is those, they call it horizontal strip. And it's going to cover, it goes from anchor to anchor. And notice how I do this. You can start here and bring it like that. I prefer to kind of pull a little bit and just, so I ensure that it goes flat on the back. Because sometimes if you don't, you could get a wrinkle and a little blister or something. Okay. Now watch the basket weave technique. So that's our first horizontal. Which direction do I go for my vertical strips?
Medial to lateral.
Medial to lateral. So I'm going to start on the medial anchor. And a common mistake people make is they go like this. You want to cross each vertical strip at the base of the calcaneus, base of the heel. Then you bring it up to the opposite anchor. Then we alternate it like a basket weave. I'm going to go back to my horizontal strip. Then I'm going to go back to my medial lateral, but notice I'm not going to go right on top of it. I'm going to alternate an angle, but I'm still crossing the heel. Right? Then I'm going to go to my horizontal, and I'm going to do my third vertical. After my third vertical, and notice I'm kind of alternating again. I'm covering the entire medial and lateral aspect of the ankle with my vertical strips. After my third vertical, then it's just closing with horizontal up to the top anchor. So they actually go all the way around now. Keep it up at 90 degrees for me. You got to remind your patients throughout to have proper positioning, or else it will mess up your angles. After you get to the top and you're done with your horizontal strip, then we do those 2 to 3 lateral to medial arch support strips. So you go here to here, again supporting a little bit on the medial longitudinal. Yes?
I just wanted you to meet my son, but you're busy, but they're doing the racks.
Oh, okay. Hello, Miss Edmondson. Oh. Okay, after your second arch support strip, here's those heel locks. Pay attention because this is the hardest one. I do it, and I would consider normal how they described it as like a reverse. You always start center shaft of the tibia, and then you're going to use your malleoli to guide your angles. So you always want to go at at an angle right above the malleoli, whip it behind the heel, and then your heel locks are going to look like angled strips right here. So if I start here, I bring it around. Here's my lateral. That's a lateral heel lock. And then you bring it to the top of the foot. And you're going to do 2 alternating on each side. Then I'm going to go in the opposite direction. Here's my medial heel lock. Boom, right there. Medial heel lock. Then I repeat the same pattern. Oops, I'm actually doing medial. It doesn't matter which direction. You could either do 2 medials or 2 laterals. So I did my second medial. So I'll end with my second lateral strip. And once you're done with your 2 heel locks, then the taping part of it's done. Then you check for any windows. Check for any windows. Ask the patient, how does it feel? Fine, okay. You don't need to make any adjustments, then we can remove. Now I'm going to have Alyssa do it today. You as a practitioner can do it too. Here's the direction of the shark. You're going to place the plastic flat edge on the skin between the pre-wrap and your skin. Then you're going to cut behind the medial malleolus. That bump is going to go out here straight down, then turn and go straight out like that. Okay? Well, let's say you're going to do it. Just push down all the way. This is the pattern I just showed you. And turn it outward. Don't cut it. Boom, cuts it off. You can do, you know you have a good tape job if you hold it up to the light and you don't see any windows or gaps or anything like that. I could autograph this. I'm just kidding. Properly dispose of your materials. Report back, you're finished. Done. Alyssa gets this table. She gets to use these supplies with her partner. Everybody else